Hello, my name is Robert Nutting. I'm from the United States. In the United States, I'm a critical care paramedic. I work primarily in the ER and also on the ambulance. When I come down here, I help out in the barrio teams, go out there, help to the clinics out there. And I also help out here in the surgical teams when we go into the clinic here, and I help out in the OR. Some of the most important things we do as a paramedic, especially like a critical care paramedic, we help emergency patients that come into the ER that are in life-saving need for help. We focus on three main things when it comes to saving life. You have your airway, breathing, and circulation. Very first thing we make sure is that they have air coming in and out. So if we need to intubate them, we put a tube in their mouth, we breathe for them, put them on what's called a ventilator, give them some meds to help them breathe, stuff like that. When it comes to bleeding, we look for any obvious signs of bleeding. You know, if they have a trauma, their legs cut off or whatever, we want to make sure we stop the bleeding, prevent them from bleeding out and stopping their heart that way. In return, we also give blood products back into the body to help them replenish the blood that they lost or regular fluids we get back. And then circulation. That mainly focuses around the heart. We want to make sure the heart is still continue to pump and pumping the blood that we put in their body goes around. So we have different meds that we can give to help do that. We also have equipment that we can have that can actually help beat the heart for them. And that plays a lot of big role when I come down here, especially when I work on the OR team. I help with the intubations, make sure the patients that we bring into the clinical, into the OR, make sure they can breathe while we do their surgeries. I help keep them alive that way. And then my years of experience doing this, I bring it out into the barrio team by helping to examine some of the patients that come in, especially through the triage area that we have. I get their vital signs, make sure they're doing okay there, figure out what kind of medications they're taking, and this way I can give a better understanding to the doctors about what's going on with the patient. So overall, my experience from everything kind of helps in both aspects and when we come here.
Great. How many times have you come to the Dominican Republic?
So I've been down to the Dominican Republic now about 6 times. My first time was in 2012. I've come down multiple times since then. First time I'm down here, I was just in the barrio teams. 2015 and 16 were my first years in the OR here. And then this is my first time coming back after COVID.
And what about the experience, like working here in the Dominican Republic?
I absolutely love it. I know a lot of people don't have trouble with it just because it's a different atmosphere, especially coming from the United States. But the part I love most of being down here is the culture that we have down here. The biggest community, it's all about community. Everybody wants to help each other. And that's what fills my need and what I believe what God's placed on my soul is to help people. And I just want to help as many people as I can down here. So I very much enjoy coming down here and helping everyone down here.
Great. Do you speak other languages besides English?
I do not officially. I mean, I speak computer language, but that's more about coding, but I guess.
Have you faced the need to speak other languages?
Yeah, especially down here. I am slowly learning Spanish. My Spanish is very low, but I'm definitely getting there.
Great. So what is the last message for, from you to the other people in general?
Follow your passion, especially when it comes to if you want to get into medicine or anything like that. Follow your passion, work hard, and it's not. Just remember, it's not about you. It's about helping other people and helping as many people as you can.
Great. Thank you.
Of course.